To our hypertension and cardiovascular disease interdisciplinary echo series. Our echo series focus on hypertension and cardiovascular management and control. And we're looking to really bring together our community and clinical partners. So for those of us joining us for the first time, we just wanted to share a little background about our echo series. And we have a really exciting presentation today. We're going to start off with our didactic presentation coming from Mina and Timothy from the University of Mississippi School of Medicine, followed by a case review on the state of food insecurity presented by Erinn, Rowe, the CEO of Harvest Hope Food Bank. And then we will lead into our questions and discussion. We'll highlight our next session, and then we'll have some closing comments. And then we'll do our post-echo survey. All right. So for our introductions, we want to start off with introducing our subject matter experts. For those joining us as a participant, please go ahead and share your name, your employer or organization, and your position in the chat. But we'll start off with our subject matter experts, and starting with Dr. Bretler, please.
Hey, good morning. Good afternoon, everyone. Jeff Bretler. I'm an internist by training, and I help co-lead the hypertension program in Kaiser Permanente in Southern California, and also serve as a consultant for hearts for the Pan American Health Organization. Glad to be here.
Great, thank you. I'm not sure if Honey Estrada is with us, but she serves as our community health worker subject matter expert. I do believe Emily Ridley is here.
Hi, good morning, good afternoon. My name is Emily Ridley. I'm a clinical pharmacist based out of an internal medicine residency clinic within Prisma Health in Columbia, South Carolina, where I primarily work with a low-income, urban, and rural population patients. I've worked here in our health system with quality improvement efforts regarding hypertension control, and I've also worked with the Pan American Health Organization Hearts Program.
Great, thank you so much, Emily. Dr. DePetty.
Well, good afternoon or good morning, everyone. Don DePetty. I'm here at the University of South Carolina School of Medicine. I'm the Health Sciences Distinguished Professor here, also an internist, as is Dr. Bretler, specializing in hypertension. I'm also an advisor to PAHO, and also as a disclaimer, I'm on the board of Constellation Quality Health.
Great, thank you so much, Dr. DePetty. And we also have Dr. Lackland and Monty Robinson, who's also our subject matter experts. They are not on here, but they do serve in a great capacity for our ECHO series. And thank you to all of our participants for sharing your information in the chat. All right, let's begin because we have a really exciting and interesting presentation today. I would love to introduce you guys to our didactic presenters. Please meet Mina. Mina is a fourth-year medical student applying for her internal medicine residency at the University of Mississippi School of Medicine. She grew up in Mississippi and has developed a passion for medical access and education in rural settings. And through her work at the Student Health Coalition, she has initiated nutrition initiatives, highlighted her time at the medical school by encouraging awareness on chronic disease risk factors, cultivating community empowerment through one's health status, and creating simple interventions to improve dietary habits within at-risk populations. Joining her is Timothy, also from the University of Mississippi School of Medicine. He's in his second year of medical school, and he's currently interested in pursuing a career in internal medicine and pediatrics. He has loved working as the director of the Student Health Coalition's nutrition team for the past year. And one of his favorite aspects of this role is getting the chance to help educate the student population on the vital role good nutrition plays in healthy living. And I would also love to take this opportunity to introduce Erinn, who is our case review presenter. She is the CEO of Harvest Hope Food Bank in Columbia, South Carolina. She's been their CEO since March of 2021, and she oversees the operations of over 20 counties in South Carolina. And under her leadership, she has been able to distribute 33 million pounds of food annually through the use of 400 partnerships across the state. Previously, Erinn spent 10 years at Bank of America and owned Young Chefs Academy, promoting healthy eating habits for kids. And she also holds a degree from USC's College of Hospitality, Retail, and Sports Management. Erinn's passion is feeding people, whether in her kitchen or in the community. I want to take this opportunity to welcome all of our amazing presenters. And at this time, I'm going to hand it over to Mina and Timothy to get us started.
Hi, everyone. Thanks for being here today. Again, my name's Mina Motakhaveri. I'm a fourth-year medical student at University of Mississippi Medical Center in Jackson. As of July 1st, I'll start my training as an internist. So our match day was just this past Friday, so I'm still feeling all of that excitement from that. And I'll let Timothy say hello real quick as well.
Hey everyone, I'm Timothy Martin. Like she said, I'm a second-year medical student, also at the University of Mississippi Medical Center, and I'm super excited to be here with you today.
Yeah, so we're both really excited to be here representing the nutrition team, which is a part of the Student Health Coalition here at the University of Mississippi Medical Center. The Student Health Coalition is a student-led campus-wide organization that was founded in 2022 with the objective of bringing health screenings and education to medically underserved communities of Mississippi. Two of my classmates and I developed the concept of this the summer after our first year medical school, and I took over the nutrition component, which is something I'm really passionate about, which is what we'll be focusing on in today's presentation. But we have come from 0 members of the Student Health Coalition to over 300 across UMMC, as well as we now have established ambassador programs at undergraduate universities around Mississippi as well. And we have provided free health screenings for over 5,000 people across the state. So we could go ahead and go to the next slide, please. Okay, thank you. So this is just a little roadmap outline of what we'll be talking about today. We're going to define our problem. We're going to talk about solutions to this problem, barriers to get there, and ways that we can get around those barriers. So next slide, please. So our objectives. Non-compliance, which is not, we don't love that word. 2, we want to emphasize the importance of starting the conversation about barriers to care. That's really half of the battle, is just identifying patients that might need some extra help and opening the floor to having those conversations. And number 3, providing examples of simple, easy to implement interventions to offer patients who might be struggling. So that's a little overview of what we'll be talking about. So we can go to the next slide. Okay, so why do these problems matter? And I'm sure all of you are aware of this already in some capacity. Cardiovascular disease, the leading cause of death in the nation. Cerebrovascular disease is number 5, and diabetes is number 8. Mississippi, where Timothy and I are, ranks first in the country for cardiovascular disease and hypertension deaths, and 3rd for diabetes mortality. Again, not surprising, and you all, I'm sure, knew that already. Poor diet and obesity are 2 modifiable risk factors associated with the development of these diseases. And this is really important because this is a problem that's just continuing to grow. More than 2 in 5 U.S. adults and 1 in 5 U.S. children have obesity, and these rates just keep going up and up and up. So we can go to the next slide. So this is a quote from the CDC. Chronic diseases account for most illnesses, disability, and death in the United States and are the leading drivers of healthcare costs. So in addition to quality of life and benefit to people. It's a big strain financially on the healthcare system. So 90% of our healthcare expenditures are spent on management of chronic and mental health illness, and our annual healthcare expenses total about $4.5 trillion. So 90% of that is a huge chunk. With diabetes being the most expensive chronic health condition in the country, an estimated cost for diabetes complications per person per year is almost $6,000, which is insane. It's a lot, and diabetes complications are only increasing in rates, which is the really scary part is for young adults and middle-aged adults. And then we have heart disease, stroke. They cost the healthcare system about $254 billion annually, with costs projected to hit roughly $2 trillion by 2050. So this isn't something that's on the right track and going to start slowing down anytime soon. According to the CDC, public health interventions that cost less than $50,000 per quality adjusted life year, which is a way that they calculate it, are widely accepted as being a good value or cost effective. And specifically using team-based care, which includes community health workers, like some of the things that we do at the Student Health Coalition, could prevent up to 91,900 heart attacks, almost 140,000 strokes, and 115,400 cardiovascular deaths over 5 years among U.S. adults with uncontrolled hypertension. And Medicare could save up to $900 million over 5 years with these types of interventions. So team-based care, a multidisciplinary team like pharmacists, community health workers, and initiating projects that help increase patient education and awareness of their own medical problems. So next slide, please. So quick review of modifiable, non-modifiable risk factors. Things that we can control: physical inactivity, obesity, unhealthy diet, high blood pressure, smoking, high cholesterol to an extent. These are all things we can do something about, versus non-modifiable like age, race, gender, family history, and genetics. So what we're talking about today is the modifiable ones and things that we can do. So next slide, please. So some solutions, again, something y'all are aware of. Taking on modifiable risk factors of CVD and type 2 diabetes starts with small decisions and small steps. A study called the DASH diet enhances the blood pressure response to losartan in hypertensive patients, published in the American Journal of Hypertension, showed that participants, when taking losartan while also on the DASH diet, reduced their systolic blood pressure by 18 points compared to 10 with losartan alone. And the DASH diet mainly focuses on heart health and reducing sodium intake. So next slide. And so we want to intervene at the point of like, what can patients start today? What changes can we make right now? And this is something that we talk with patients about at our community health screenings with the Student Health Coalition. Exercise recommendations from the AHA are at least 150 minutes of moderate intensity exercise per week. And moderate intensity exercise can be things like brisk walking, water aerobics, dancing, gardening, tennis, or pickleball. So the main thing is picking something that you enjoy, because you don't want it to feel like a chore. If you enjoy it, it'll more likely be transformed into a habit, something that you're able to keep up with. Another easy tip: skipping an elevator, climbing 5 flights of stairs per day can lower your risk of CVD by 20%, which is a lot. It's insane. And then nutrition, which is what Timothy and I focus on with the nutrition team specifically. There are a lot of barriers to good nutrition, especially in places like Mississippi. So it's easier said than done when you say just eat healthier. But a guideline that is widely accepted is the My Plate guide. So having half of your plate of fruits and vegetables, eating a wide variety of colors of fruits, and have most of your fruit intake be in the solid fruit itself and not juice, which usually is devoid of a lot of the fiber and has more sugar in it. Vegetables, again, a wide variety of colors. Dairy, 3 servings per day to increase your calcium intake. And grains, try to eat mostly whole grains. Refined grains like white bread and white rice have less nutrition. And then proteins. You don't need as much as people think. It's still very important, of course, but about a palm-sized amount lunch and dinner. Can come from beans, nuts, fish, chicken, sources of lean protein specifically. Okay, next slide, please.
Awesome. So we've talked a lot about the necessity for patients to create this good soil of change in their life. And honestly, it all sounds great, but it's not as simple as that, as y'all know. There are a lot of barriers that we've discovered just from living within this state, and I'm sure y'all have as well, to creating this soil for good change in their life. And that's kind of what we're wanting to attack head on with our solutions that we've got today for you. So the big barrier that we're thinking about mainly are food insecurity and food deserts. And so food insecurity is just defined as having an uncertain availability or ability to acquire nutritionally adequate foods. It's usually associated with food deserts. A food desert is defined as an area with limited access to fresh, affordable, healthy food, combined with the risk factor of low income of the residents living within that community. Some criteria that they normally look at to define a food desert is having at least 33% of your residents living greater than 10 miles from a grocery store in a rural area, 33% of your residents living greater than 1 mile from a grocery store in an urban area, and having greater than 20% of your residents living at or below the poverty line. So from a nationwide perspective, about 6% of the United States population currently lives in a food desert, which is about 20 million people. However, our home state of Mississippi is actually at 31% of our residents living in a food desert, which is the highest population of individuals in the United States. Living in food deserts, as Mina was talking about, can actually predispose you to some of these diseases as well. And so our solution is aimed at fixing this problem of a food desert through certain barriers of access and care. And so while spending some time at the local free clinic here in Jackson, Mississippi, Mina and I both polled the residents here to kind of figure out, okay, what are the main issues that are preventing y'all from accessing good food and good care? So go ahead and head on to the next slide. So in polling some of these residents here at Mississippi, 60% of them said that cost was the number one reason why that they didn't want to eat good nutrition, while 30% of them said that access was the main reason, and the last 10% said that time was the main reason. So cost, access, and time are these main barriers that they're struggling with. And what are they left doing? So with cost, access, and time being the issue, many of them are choosing to eat fast food often. And so about 65% of those surveyed endorse eating fast food at least once per week, with greater than 40% reporting multiple times a week or a daily consumption of fast food. So if residents here in Mississippi are struggling the most with eating healthy due to issues of cost, access, and time, and they're choosing just to eat instead at fast food restaurants to fill their needs, something has to be done about this. And it just so happens that we created a program that does just that. So we can head on to the next slide. So this is the General Diner. This is an initiative that Mina created and I've helped run this past year that helps provide healthy and delicious recipes that are all approved by dietitians at the university, recipes that are cost, calorie, and time effective, while all their ingredients can be found at, you named it, General. So here we have a few of the 32 recipes within our book, spanning from healthy snacks to dinner entrees. Additionally, we have ambassador recipes that are sent in. So these are recipes that are part of those college groups that Mina was talking about all across the state. So we're encouraging college students to take initiative over their own health while they're in school still, to cook good recipes and then send them to us so we can include them in the book. Because college students, as we know, often struggle with time, access, and cost as well. And so they're good people to be able to understand kind of what we're going through in Mississippi in a lot of ways. And so not only do we have these different options here, but we get pictures sent in as well. And so we have pictures for all 32 of the recipes that we have within our book. And so kind of looking at how we're going to address each of these problems, if you'll head on to the next slide, we have a sheet that shows kind of a cost and time address issue here with this document. So what's showing here is that we've got an average cost per serving listed for each meal, as well as an average time of preparation. And so when we get recipes sent in to us by our ambassadors, we kind of vet them along with our dietitian to make sure that they meet certain criteria, so that when we add recipes to the book, we're not exceeding that cost factor, we're not exceeding that calorie factor or that time factor. Our goal is to have no meal exceed 30 minutes to prepare. Our goal is also to have no meal exceed $3 per serving. As you can see, we're staying under that right now, but when we get new items in, we're trying to make sure that it stays consistent across the board so that we're meeting these aspects of cost, access, and time for our residents here in Mississippi. And so kind of going forward, we chose the Dollar General Diner on the next slide because of the access aspect. So we realized that we wanted to pick a store that not only was everywhere, but also specifically placed their stores in areas that meet rural communities' needs. And I have a personal example, a little bit of this. So I'm from Laurel, Mississippi, and right outside Laurel, Mississippi is Stringer County. And Stringer is a very tiny little county. It's been a dear place to my heart because we have some property out there that we go and spend time in. But in 2019, the whole area got wiped out by a tornado, and it was devastating for that community. And they had to drive. They were already driving 25 minutes into town to get food and groceries and everything that they needed. But Dollar General set up early 2020, right before COVID hit, right outside that community. And now they have a place they can get groceries. They have a place they can get food for their families. And it really helped facilitate the recovery of that area in a lot of ways. And it's still a vital part of that community when I go home now. So I got to see firsthand how important something like just a Dollar General can be. So Mississippi actually has the highest number of Dollar Generals per 100,000 people, more than 7 times the stores compared to the leading grocery store chain. And over 5,000 Dollar General markets are also now available. These are Dollar Generals that have fresh ingredients included in their stores. And so we're hoping that those expand across the United States as well. So with these fresh ingredients, we're hoping to add some recipes to our book with a little marked tomato on the side that shows it's a fresh ingredient recipe that shows that it's got some ingredients that you've got to find at a Dollar General market instead of a regular store to kind of distinguish the two as well. So we've addressed cost, access, and time through these different things. But we don't just want to make cooking reasonable and approachable for people and palatable for people, but we want to make it fun. We want it to be something that they enjoy doing. And so we've also got some tips added as well. So if you'll go on to the next slide. So a couple of tips that we've got in the book are just encouraging people to think about what they're doing when they're cooking, just small things that they can do, looking for high fiber foods, reducing their fat and calories in their ground beef by draining off the extra grease, as well as placing the beef in a colander and running it under warm water to rinse off additional fat. And then one that I know I've personally adopted is draining the liquid from canned goods to rinse the container, rinsing the contents off with water before using them. This just helps me a lot reduce my own sodium intake. And so it's something that I encourage anytime I go and work a food demonstration for people to do, because it's simple and easy and it can reduce sodium intake when you're cooking. And so there's many more of these in the book, but the goal of this is just to make cooking fun and also healthy for their diet as well. So you can go on to the next slide. Over the past 3 years, we've distributed over 160 physical copies of this cookbook, while the online cookbook that we have has been accessed over 700 times. And we've had the joy of providing food demonstrations at local events in the area just to show people how easy it is to cook healthy and good food for themselves, as well as we'll pass out recipes there, pass out the QR codes so they can scan the book there. And these have just allowed us to meet people where they are and be able to understand where they're coming from, because we ask them these questions of what's preventing you from getting what you want to get to, because most people want to make those changes occur, but they don't have the ability to be able to do that because of the context of where they're raised maybe, or just the culture that they grew up in. And so it's our goal not to even stop there. We are currently trying to translate the entire cookbook into Spanish, because over 70,000 people in Mississippi speak Spanish as their primary language. And so we're about halfway through with that right now, working with another organization on campus to do that. And then we're also trying to educate future physicians like y'all, or physicians like y'all, and future physicians at college campuses across the United States, to try and encourage people to be able to make these changes and give them a resource to be able to talk to their patients about. And so our goal is to continue to provide these food demonstrations in the area and get this cookbook not only on college campuses, but also doctors' offices. Right now, we're working on getting more printed so that we can get them in the local clinics and pediatrics clinics and other areas across the state. So it's kind of our goals going forward. So just kind of in summary, going on to the next slide. Cardiovascular disease and diabetes are serious problems, not only just in Mississippi, but across the entire nation. And nutrition and exercise are 2 modifiable risk factors for these diseases. Our goal, like Mina said, is to start with small steps, and that's something we encourage the residents of Mississippi and our patients to do. No habit is done by jumping right into it. And so when I talk with residents about this, I normally am telling them, try just cooking 1 meal a week from this recipe book. If you like it, then go for 2 or go for 3, or try cutting off 1 fast food meal a week and just go from there. So cost, access, and time are the main common barriers to good nutrition. And this Dollar General Diner is a huge deal that can help bridge these gaps. So we've got a little flyer at the end that's a QR code, but also please reach out to us. I'm sure that you'll have your emails as well if you'd like some of those free flyers. So kind of to summarize for you as providers as well, some key takeaways. The residents of a food desert are often restricted to consuming foods with a long shelf life and lack of accessibility to fresh fruits and vegetables. The main kind of takeaway that we want to have for y'all is that by you understanding the context of where your patients are coming from and having something like this that's a solution to those cost, access, and care and time barriers, you're going to show a lot more grace and understanding and be able to empathize with your patient. And that's going to work on that patient-physician relationship and be able to build trust there. Where if they hear you understanding where you're coming from and saying, oh, he gets me or she gets me, they know that it's hard for me to get this food, so they've got something for me that bridges that gap. They're going to be willing to take your advice and trust you in other things as well. And so our goal with this is just to make sure to give you a tool that you can use to be able to really bridge that gap and give you a better sense of trust with your patients as well and understanding there. So I think that's everything that we've got. We've got a little QR code on the last slide that will take you to our online cookbook. It is updated constantly. So if you're interested at all, feel free to scan that. We update it regularly and add new recipes to it as well. So thank you so much. We've got our references on our last slide and we are open for questions.
All right. Thank you so much, Mina and Timothy. That was a very great, that was a great presentation on your program and the incredible work that you guys are doing. I want to pause here for us to go into our case review. And I think because Erinn is the CEO of a food bank, it blends very well with our didactic presentation. And then we can go into questions and discussion. Right. All right. Welcome again, Erinn. I will pass it over to you to address the state of food insecurity.
Thank you, and thank you for having me today. This is a topic that's very near and dear to my heart. I do want to give me and Timothy a shout out. I love everything about your approach to this presentation. It really aligns with how you care for people and going to them where they're at, because I see that a lot with people trying to address food insecurity. And I see it with a lot of basic human health needs. When we are out there wanting to help people, it usually is from a very good place, but we want people to come to us and we want people to come to where we're at and feel comfortable helping them, but that's not the way humans work. We're very complicated, beautiful people, and you miss out on true connection and that trust piece that you talk about. We expect people to come to you to give them something. So I do love that you created this whole approach to where people are at in their lives and their families and their cultures that is approachable. And I think that's going to be very successful. When you think about food insecurity, and I'll reiterate what Timothy said, is that moment in time where people are having to make a choice between paying for a bill or item in food. And as we've looked over the past several years, COVID's shone a light on what food insecurity is. It's been around conceptually forever. We've always had people that struggle with food insecurity, but it wasn't talked about. It wasn't made aware as it is now that it's so common. I think people associate food insecurity with homelessness a lot, or addiction, or these very polarized environments that people do struggle with, but that's not really where we're seeing food insecurity. The majority of the people that we minister to and feed are working poor. They have jobs. They just don't have the paycheck that lasts from one paycheck to the other when their bills come in, and they have to make decisions because their car broke or their kid is sick, so they can't go to work. So it's really shifting that narrative that people that are food insecure are the ones that are struggling the most in our society, when if it's 1 out of 6, that's 1 out of 6 kids in your class or people that you work with. we're really trying to normalize what it is. There's a lot of reasons that food insecurity exists. I say this all the time. It took us a lot to get to this place. Numbers show lots of good and bad stories. Is Timothy and Mina talked about the state of Mississippi and food deserts and food access. You know, that's not the number one you want. It's not the number one basketball championship, but it does take a lot of people in a lot of industries to get us to this state. But I always like to say we can always undo it. Numbers are changeable. They're not static. We got here, we can unget here. But it does take people being very deliberate about it. It takes people having conversations and addressing the root cause of food insecurity. People don't wake up one day and decide they're food insecure. It's usually a snowball effect of decisions and experiences and accessibility to things that ends up being at this place that I can't turn my lights on this month, or I'm not going to feed my kids. What am I going to do? And it is those hard decisions. So when you look at the barriers to food access and the drivers of food insecurity, a lot of times you're going to see the same components that are driving health disparities, because most disparities have common themes and common denominators, and you can't look at them in a silo. And I do like looking at this problem holistically as a group effort. It's a group project we all need to work on. It ties into so many different things. If you think through a high cost of medical bills and the state of diabetes and obesity and heart rate, the cost of going to the doctor and having that medication, that reduces how much money I have to buy food. You see the cost of rising food. Food costs about 10 to 12% more than it did 5 years ago. So I'm getting 85 cents on the dollar of what I could buy before, and not including things like bird flu that makes chicken eggs $15. You know, during COVID, cereal was $10 a box. I wasn't even feeding my kid. I was like, you know, you're eating toast. Like, that's too expensive. I'm not spending that much. But it really is looking at it from a root cause narrative and solution. Rising house costs, affordable living, cost of transportation, all that rolls into access. So if you think through our rural areas and you typically are living paycheck to paycheck, my assumption, and I think it's a fair one, is that you're not driving a brand new car that has a 100,000-mile warranty, that if it breaks, I don't have to worry about paying for it. You're typically driving a car that breaks all the time, because that's what older cars do. So then it's hard to get to food. And I love the fact that you use Dollar Generals, because I have heated debates and topics and conversations about this. So if you think about how food access has shifted, we did have smaller community grocery stores historically up until the big box stores and just kind of the economy. It outpriced them, for lack of a better term. And so in those smaller stores, you were getting more localized ingredients. Farmers didn't have to have all of the regulations to sell to the Publix and the Food Lions and the Whole Foods, because those agriculture regulations price out small farmers. So that's another part of why the local food access is diminished. We commodity buy now. So we don't grow a lot of food in this country that people actually eat. We grow a lot of soybeans, we grow a lot of feed corn and things like that. But the cost of growing food that people actually eat is really expensive, because that food is very fragile. So if you're going to grow butter beans compared to seed corn, butter beans are very fragile, and it costs too much to grow it, to be quite honest, which is why we outsource it from other countries. So going back in a very long-winded way, people want to vilify Dollar Generals a lot. You know, they want to blame Dollar Generals for, you know, picket, whether it's our health. But if the Dollar Generals weren't where they're at, half the country wouldn't eat, to be quite honest. So I love the fact that y'all approached feeding people healthy with a store that's actually in their communities, and it is probably going to be there for a minute. It is just the way of the world right now. So if we are going to address food insecurity, especially with health disparities, you have to use the resources that they have right there in their community. I do think there is great conversations that have been had around food insecurity. I do think that people really want it to not be an option. I say this too, it's asinine to me, honestly, that we live in this country and we have such a high food insecurity rate. It's not acceptable to me, which is why I do what I do. But I do love people coming together like this group to be able to talk about it, because we can fix it right here if we just work together. Questions, I mean, I know I've talked a lot and I would love interaction, so I can pause for a moment and we can answer questions or move on.
Thank you, Erinn. I think this is a great opportunity for us to open it up to our team and our participants for any questions or discussion points.
Quiet group. I want to know the favorite recipe that everybody wants to make from your cookbook.
Well,
There's actually some really good ones in here. I have a sample of our like what the printed one, the newest version of the printed one looks like. It's kind of blurry, but this is the size. We also have a list of Food Network partners and resources for the area of Jackson on the back. And I actually use this a lot. I make a lot of recipes from this, and there are several of them that I do on a regular basis. So I would definitely encourage y'all to try it.
I feel like the most popular one, at least when we were doing food demonstrations, is this like buffalo chicken roll up that we have in there, because it's got like spinach worked into it, but nobody can taste it, and so it's like I don't know that it's in there, and so I think that's probably the one that gets the most popularity to it, and gets people interested. And then there's like some peanut butter like balls in there that have like oats and dark chocolate chips and stuff. They're kind of like a breakfast snack, and that one's really popular as well.
Great, thank you. I think Nikita had a question, and then we'll go to Dr. Tepetti.
Oh no, I was just going to make a comment that this is a great tool because being a certified community health worker, I help push our registered dietitian nutritionist to our patients, because majority of them do have chronic, illnesses, and that just eating properly can help them in a lot of ways. But they, like you say, they just don't know how to. And because we have a Dollar General right here on the corner, and a lot of our patients do visit Dollar General for food, this is a great opportunity for our registered dietitian and nutritionist to share this cookbook with them in hopes to provide some improvement in their lifestyle. So this is a great tool to have.
Thank you so much. And y'all, please, if you want a flyer, we have a flyer that you can use to advertise to patients. You can put it in your clinics, just so they know what the QR code is. The QR code is on that. If you put your email in the chat, I think Miss Kathleen will send that to everyone afterwards.
I will. I'll be sending that out to everybody as soon as we're all done here.
Dr. Tepetti?
Yes, Tim, I think you touched on it. Yes, the barriers that you allude to, and by the way, I'm in South Carolina, so we are compatriots in this. Our data is not any better. May not be worse, but it's not better. But Tim, you touched on it. A lot of my patients, and I'm gonna do a mea culpa or whatever the word is. This one's me. I'm a case report. I just don't like the taste of healthy foods. Maybe it's been my upbringing since I was a child, et cetera, but it's a lot of years worth. I know better. I've got means, I've got access. I don't have any of the, or seemingly any of the other barriers. It's just taste. So I use myself as as sort of like the tip of the spear, but many of my patients tell me the exact same thing. And what we've turned to here at USC and in South Carolina in our food share program is cooking demonstrations, but that can't reach a whole lot of people. Do you have any other suggestions of how do I personally get over the barrier of taste, but then how do I also help my patients get over the same barrier, and that we can work on this together?
That is a great
Yeah,
question, and it's a really good point. Yeah, I think it's a common struggle that a lot of people deal with. That's something that we wanted the book to touch on. Everything in here, it has to taste good. You know, we're not going to put something in there that's boring or it doesn't actually taste good. People aren't going to like it. In terms of like the food demonstrations, we do the food demonstrations like at the health screenings that we provide and at the free clinic, like in the waiting room while people are waiting for their appointment. We have a little booth set up where we do some demonstrations and they come up, taste it, and they realize, oh, I actually do like this, and we talk to them about it. And so we do that out in the community as well at our screenings. And I think the photos help a lot too in the books, because someone can see, like, you're not just telling them to eat a bag of lettuce or something. They like look at the photo of like our pineapple fried rice or something, and that just something to kind of like entice them and get them excited about trying it, I think is the one of the things that we have to tackle.
Yeah, and going off that too, like I think one of the tips that we have in there, I don't think I included it in my tips slide, but like is talking about utilizing spices more than salt in terms of your cooking. And I think that can be something that a lot of people are scared because they don't know maybe how to use spices well, and they just assume that to get flavor in food you have to add salt, and we know how that goes. You know, you add more salt, surely it does taste better, but then that's kind of where we get some of these problems that we're having. And so a big thing that we emphasize at some of our demonstrations is cooking with spice as well, because you're not adding that salt to your diet, but you're still helping the food taste better. Seasoning your, you know, if you're choosing to cook with chicken or whatever it is, like seasoning it beforehand, just like giving it some of those practical tips of helping it taste better without having to use so much salt in their cooking and stuff as well.
I'll add on to that. We trained ourselves to only taste sugar and salt holistically as a country. And so a lot of fast food, why it in your brain thinks it tastes good is that's all you can taste. And so we really have to retrain ourselves as a country on tasting the actual food and not just additives, whether it's MSGs or salt or sugar, because it masks and it's a chemical, we're addicted to it. I mean, it's basically a chemical addiction. And so we actually are addicted to that and not the way true food tastes. And it is a battle, and it is, like you said, using different seasonings that's not those pre-made seasonings too, because most of those pre-made seasonings are just full of salt, which is why you think it tastes good. So it's retraining the taste of a fresh vegetable, just needs to taste like a fresh vegetable and not salt.
Thanks, everybody. And thanks for letting me vent. I'm trying. I am still trying. Dr. Bretler will tell you, don't go out to dinner with me. He's embarrassed. I embarrass him.
I would jump in and add to that the use of ambassadors. You know, whoever you get to come to your cooking classes, and that's limited people, but invite and encourage people to go back to their families, their neighborhoods, their friends, and share what they like about it. Because there's nothing better than word of mouth from someone you know and trust. And I'll also comment, I loved what Mina said about we don't like that word non-compliance, because, and then what you spoke about, Erinn, and you too, Timothy, to agree is really finding out what the root causes are to why people are eating the way they're eating. And if it's cost and other issues, you know, transportation insecurity. So Dollar Generals, you know, a lot of people can walk to them. And I think it's just great that you're playing off of a cookbook with recipes that are healthy and taste good and are accessible to people. So because it really does get to those root causes, finding people where they are, meeting them where they are, and helping them figure out within their situation and their community what will work for them. And since you're translating into Spanish, that's great. But we have, you know, some of our communities across the nation are just melting pots. And so I love the pineapple fried rice, that might appeal more to an Asian population, for example. So it sounds like you're really thinking broadly about not just in the South or where you are, what's going to taste good, but what we can cut and paste and use in communities, whether they be metropolitan or rural or somewhere in between. So thank you. Great speaking engagement today, and really helpful practical advice for us all to take and share. Thank you.
Thank you, Sylvia. I want to open it up for any other final questions or comments. We have just about 10 minutes left, and we have some information to share towards the end, including that post-echo survey, Nikita. So, but before we move on, I want to really extend our appreciation for our speakers today. Thank you, Erinn, Timothy, and Mina, for taking your time on really educating us on the best practices and for nutrition, and really lending your expertise to sharing your understanding of food insecurity. This work is really important to not only our community members and our patients, but it's really important for our collaborative effort as we establish these partnerships and coalitions. So thank you again for taking your time. I'm going to hand it over to Kathleen to close us off.
Thanks, Maxine. Okay, so just a reminder. Oh, yeah, go ahead.
I just have a quick question. So would there be a second part or an addition on like a what's next after this for this series? And or because I would have loved to have my registered dietitian nutrition on this call. Just asking the question. And I know it's a answer too with a period.
So
we do upload our videos on YouTube, and they are available in the iEcho. Our series runs on a monthly basis, and we host a bevy of different topics related to hypertension and cardiovascular disease. So I encourage you to share our video links for this session with your RDNs or any of your colleagues. But there might be a part two. We'll have to extend our invitation to Mina and Timothy and Erinn for a part two. So it's encouraging to hear that you guys are interested in a part two.
Yeah.
I would love that.
Definitely.
Just let me know.
Yeah, definitely. We will get in touch with them and see what we can do. I will go ahead and let you know that the YouTube video usually takes about a week or so to get up on Constellation's YouTube channel. So I can go ahead and email you all when it's uploaded. That way you can go ahead and see. And again, I'll send out that flyer as soon as we're done. So you'll have the QR code and flyer for the cookbook. So.
Okay, so you're in a week you'll email the link to this
to
video.
the YouTube channel.
Okay, thank you.
Yeah, absolutely, absolutely. Yeah, we'll get you all taken care of.
Thank you.
I'll bombard you with emails. Don't worry about it. All right. So we are always looking for case reviews or or didactic presentations. So if you know of anybody or any subject that you want to know more about, like Nikita just said, she wants to know more about this, so that's incredible. We'll take that into consideration because we are open to create this echo so it is the best for all of our participants. And if you do have a case review, a specific case that you're looking at, you can go ahead and submit that into the red cap. So that way any PHI is protected in case it accidentally got in there. Our next ECHO session, we will have a case review didactic presentation by Tammy Collins. She is with the Anderson Free Clinic Wellness Program in Anderson, South Carolina. So she'll be letting us know what's going on at their wellness program. So we're super excited about that. That's Thursday, April 24th from 12 to 1. And we will go ahead and send out those email reminders like you always get. On behalf of our entire hub, we would like to say thank you so much for participating. We appreciate you coming in and watching the ECHO session and participating, giving feedback, asking questions. If you think of anything that you would like to share with us or any suggestions, comments, you can always contact us at regionalcolab@constellationqh.org.